So today we're going to dive into a topic that's near and dear to me. Being someone with ADD and having a family member with ADD, I'm constantly weighing the use of medication. And is if there a way that I can effectively treat and manage the symptoms of ADD without the use of medication? So you know that I'm a speech language pathologist. I'm not a doctor, and I'm definitely not your doctor. I encourage you to consult your medical practitioner when it comes to medication and whether or not to take medication for ADD. But I did want to dive in with you on the very latest meta-analytic research on non-medication treatments. And what I wanted to look at is I wanted to look at what's effective, what's not effective, what you may want to talk to your doctor about trying if you're interested in either using less medication or trying this as an alternative to medication. So this is a very important decision. You're going to have to work very closely with your doctor in deciding medical matters. But I just wanted to dive in with you what some of the non-medication treatments are. And why is that? Because maybe you could find that these non-medical treatments, a combination of them, or even a single one, could be as effective as medication. Or maybe you're going to find that in conjunction with medication, these non-pharmacological treatments help your outcomes or make it so you could use a lower dose of medication. This could be really important information that could be a game changer for how you deal with ADD symptoms. I can't wait to dive into this research with you. I think there's some really good stuff to look at. The article that I'm going to draw a lot of this information from, and it is hot off the press. It's in March 2024. The journal is Curious, which is an open access. That means you could get that online without paying for it. Journal. It's a medical journal. It's peer reviewed. And the article is called Alternative Treatments to Pharmacological Therapy in Pediatric Populations with Attention Deficit Hyperactivity Disorder, a Scoping Review. And what they did is originally they took 101 articles that looked at non-medication treatments for ADHD. After that, they broke it down to the 13 articles that they felt were the most reliable and didn't have any medication used to really analyze whether or not the non-pharmacological treatment itself was effective. They looked at 13 articles that they felt were reliable sources of information. Now, some of those articles were case studies, and I'm going to try to make it clear to you when the research is not really strong to support these non-pharmacological studies. So this was on one article, and I took a couple of other meta-analytic articles as well that were from 2017 or later. So let's dive in to what they found works. So number one was, and this is kind of my middle name, movement. Movement matters. Not just any kind of movement, moderate to vigorous exercise every single day. So there's research on this. I say every single day. There's research that finds whether or not the child engages in physical activity 5 days a week or 7 days a week matters. If you're going 7 days a week, you're going to have substantially greater gains in executive function. If you have an increase in screen time, you're going to have worse gains in executive function. So movement every single day. The research is strong in that area. What does it improve? It improves a lot. First of all, it improves sleep. Secondly, it improves executive function. Third, it lessens the symptoms of ADHD, and that includes increased concentration, decreased impulsivity. So when you're looking at all that it improves, movement matters. Everyone should be moving, and they should be moving 7 days a week. Now, the next area we're going to get into that's research-based is mindfulness. And once again, I'm going to touch on movement there because movement that involves mindfulness, which would be karate, tai chi, doing a dance routine, yoga, these sorts of movement activities that are not just aerobic or cardio. Now, those are good. Those are important. You're going to have greater gains in executive function when you're attaching mindfulness to the movement. So the second non-medication improvement that you can do, activity you can do, is mindfulness. Practicing mindfulness with children. Now, I'm going to be honest with you. They don't have research to say the Calm app or the Headspace app, that these are apps that really work. They haven't researched them on children with ADHD. But that is what we're looking at, is we're looking at cognitive behavioral therapy in which children are talking through their feelings and their emotions through a logical lens. Now, I talked about how I like to do this with children through stories. When you take an incident and you're able to put it into a story format, as Siegel says, when you frame it, you can tame it, you can name it. You're going to take it out of that fight, flight, freeze, fawn, amygdala brain, and that switch is going to flip up into the prefrontal cortex logical brain. The brain is like a light switch. You cannot be in the fight, flight, freeze brain at the same time as you're in the higher level thinking brain. So if you can take situations that are difficult for the child and you can put those situations into a story format in which you're writing the story, in which you're telling the story, and you're using the elements of the story grammar, you're putting in a logical format. That is an example of cognitive behavioral therapy. And what does that do? The research indicates it improves emotional regulation. So this is very important. You can see how this complements the movement. So movement matters, but when we add to that movement the mindfulness component in which you're using higher level thinking, cognitive behavioral therapy, telling stories has a similar effect. That's when you're going to improve the emotional regulation. That's a unique piece of the puzzle. So that is another non-pharmacological, non-medication way that you can improve the symptoms associated with attention deficit hyperactivity disorder. Now, third, we're going to talk about diet. Now, even though the research on diet has been inconsistent, there's been enough studies that indicates that diet is correlated with ADHD in a very important way. And what they found is that children that have diets that consume higher glycemic index foods, these are foods easily converted into sugar when it's processed into the body. So we're talking about simple carbohydrates, right? These children are more likely to have ADHD than children who have diets that are in line with the Mediterranean diet. The Mediterranean diet is low sugar, whole foods, non-processed foods, high in vegetables and lean protein and healthy fats. Children with this diet are much less likely to have ADHD than children with a high sugar, high processed food diet. So that research is very clear that the diet does matter. There's also other research showing that increased sugar intake, for instance, children who consume more sugary drinks are more likely to have behavioral issues, inattention issues, emotional issues, dysregulation. So behavior, hyperactivity, and inattentiveness is related to sugar consumption. More sugar consumption is more behavioral and more emotional and more attentional challenges. There's a very strong correlation in research that just came out of China in 2021, in which they looked at 30,000 children and they controlled for all of the demographic factors. And when they controlled for all of those factors, they found consumption of sugar correlated these emotional behavior problems. So sugar consumption does matter. We dove in already to 3 different non-pharmacological treatments that we can use. So we said, number 1, movement matters. And the research indicates movement matters the most every single day, moderate to vigorous activity. Number two, mindfulness matters. So we talked about cognitive behavioral therapy in children seeing their emotions through a logical lens. Storytelling is a highly effective means in cognitive behavioral therapy, which is why with our kiddos, I think if you want to improve language gains, if you want to improve social emotional gains, if you want to improve pragmatic skills, empower them to tell a story. The third area we looked at is diet. Now, even though the research is inconclusive because they've done some studies where they did elimination diets, and diet is different with every child. There is strong correlational data that finds children who consume more sugar have more emotional, more behavioral, more attentional challenges than those that consume less sugar. The research is also very clear that children have diets that are high in the glycemic index, the simple sugars, the simple carbs. They are much more likely to have ADHD than children who have diets that are Mediterranean, which we're talking heavy in vegetables and lean protein and healthy fats, whole foods. So diet does matter. The latest research is finding that children with ADHD are much more likely to have metabolic disorders. So, if you think about the brain is consuming 25% of the calories. And those brain cells, just like the body, if they're not efficiently taking that glucose in the mitochondria and converting it to ATP cellular energy so that the brain can function well, so the body can function well, we're going to want to focus on that. Now, let's go into the next step, which is supplementation. Does supplementation make a difference? Now, once again, the meta-analytic research says some studies find it does, some studies find it doesn't. It's inconclusive, but I will tell you that these are supplements that multiple studies have found have improved outcomes for children with ADHD. This is something you definitely want to talk to your healthcare professional about. The first one is probiotics. And that's because what they're finding is many individuals with ADHD have a metabolic disorder. So the idea is that probiotics is going to help the body digest the food. The second one is vitamin D. This is another one where multiple studies have shown improved symptomatology associated with ADHD with vitamin D supplementation. The third one are the omega-3 fatty acids. There's been a couple of studies as well that have shown that omega-3 fatty acids improve outcomes when it comes to ADHD symptomatology. Now let's look at the minerals. So there's three minerals that multiple studies have shown to improve the symptomatology of ADHD. The first one is magnesium. The second one is iron, and the third one is zinc. So magnesium, iron, and zinc have also been shown in multiple studies to improve ADHD symptomatology. So this gives you a lot to think about. We dove into multiple studies, even though I largely relied on this latest study from this spring 2024 that's hot off the press from the Journal of Curious, the open access journal. Just take a step back through a wide angle lens. Think about how are you going to handle ADHD? Is there a way that is not just medication? Perhaps you can talk to your healthcare provider about medication and supplementation with diet, exercise, mindfulness, and supplements that are available at your local drugstore. Or perhaps you can say, maybe I want to try first exercise, diet, mindfulness, and supplementation, and see if that has an impact on the ADHD before I add medication. Or perhaps you say, we're using medication. What would happen if I complemented the medication with these non-pharmacological treatments? Could I get better results and possibly lessen the medication over time and still have the same benefit? And by lessening the medication, perhaps you can decrease the possibility of the medication becoming addictive These are just some options I wanted to share with you as I struggle and constantly weigh the risk and the reward of medication when it comes to treating ADD and thinking about what can we do that's not medication related. So I wanted to share with you what the latest research and what the meta-analytic research has found to date. And of course, that said, I am a speech pathologist. I am not a medical doctor. I am sharing with you simply research that I have found. It's your job to take this information and roll up your sleeves and make the world a better place, one child at a time. But you are always going to be first.